the question, does integrative medicine actually work? My name is Dr. Erica Steele. I'm a holistic doctor in family practice. I hold 6 degrees in my field, and I'm a board certified naturopathic doctor. And I love teaching about integrative healthcare, especially as it pertains to many things like chronic diseases. Chronic diseases, unfortunately, are on the rise. I think, gosh, I don't even have a statistic. I could pull something out of my brain, but right now we know that chronic disease is on the rise. So many people are suffering on and on with so many debilitating conditions. And so people are really looking for answers and solutions to help. And my belief is integrative medicine is the beginning of the evolution of our healthcare system. Many years ago, far before I was born, there was many different types of doctors. There was allopathic doctors, there was naturopathic doctors, there was homeopathic doctors, there was chiropractors, and they all really shared in this philosophy of service and giving to other people. And they really wanted to help heal. Fast forward till now, lots of things have changed. Lots of investments have been made. I won't go into all of those pieces on this particular video. However, it's important to know the history of healthcare and how our healthcare system has unfortunately turned into a sick care system. And so my goal and my mission is really to help people understand how these things work. And so integrative healthcare uses data to be able to track a patient's progress. So a patient will come in, we will listen, assess the case, then I'll typically run some lab panels. I can run basic lab panels or I'll run more advanced functional lab panels. Once I get that data back, I educate the patient about what the data actually means, and then I lay out a treatment plan for them. I often will use other tools to be able to measure things such as body composition, or I'll use biofeedback to assess, or I'll use Thera, which assesses the bioenergetic system. So I use all of these different diagnostics. I take upwards 350 data points, both subjective, which is what the patient tells us, as well as objective, something outside of me and the patient, so that we can measure and track the progress. And that's how we know it actually works. So we get both. We get the subjective, the patients are filling different things out that are clinically sound, questionnaires and whatnot, so that we can understand and track the progress from a subjective standpoint. And then we use the data like labs or some of the other diagnostics that we were talking about to be able to determine if the numbers have changed. And so if we are doing our part, meaning me as the provider is educating the patient appropriately and prioritizing the care appropriately, and the patient is doing their part and they are walking through a process step by step, as time goes on, the patient is designed to get better and better because they're learning more. They're learning their mistakes, they're learning what to do, they're learning how to heal, and they're following directions. Oftentimes patients will come into my practice and they will have so many things to deal with, and they just throw it all on my desk. And my role is to prioritize things, right? So as an example, if a patient comes in, they're stressed out at work, they're stressed out at home, they are not prioritizing themselves, they have unhealed emotional trauma from the past, they have poor eating habits. I can't tackle all of those things all at once. So the first thing is really getting their mindset into a different place. I have to get their buy-in pretty much that they can heal, especially if they've been to many other doctors who've told them otherwise. And a lot of times when I get patients, they've been to every doctor underneath the sun. They've been told, oh, we don't know, everything's normal, my labs look good, my labs look fine, etc. So by the time that they get to my practice, they are very frustrated, disheartened, they don't trust doctors, and they're almost like arms crossed, I dare you to help me. And so we have a big hurdle to overcome in the beginning when it comes to trust. And so I really appreciate the bravery of so many different people who come into my practice who have been through those journeys. And if you're watching this and you've been on a similar journey, it's actually more common than you may think, unfortunately. And so that just exhibits how broken our healthcare system is and how we need change really from the inside out. And so when we're working with integrative health, we need to make sure that it's not just about evidence-based. I know that is a catchphrase, and we do look to studies to help guide us, but unfortunately, there's just not enough studies out there to be able to justify care. And when I have a patient sitting in front of me, I really need real-time data. And there's so many different variables with studies. I'm not going to get into that in this particular video. What I am going to do is just say that we take data on the individual in real time, and taking that data on the individual in the real time gives us the power to be able to make those decisions far faster than, let's say, waiting for a larger clinical study. I'm hoping in the future we can get more clinical studies that are fair and balanced and actually give a holistic view of things rather than some of the biased studies that we have today. And the patient has to buy in and adapt to the care plan, meaning they have to do their part. I tend to work with people that have had history of trauma, or they have mental illness or like anxiety, depression, etc. So we want to make sure that they're not overwhelmed. And so we go over a lot of information in the beginning. A lot of times it's new information. Biochemistry can be very complex in the beginning when you first hear it, and especially too if it's contradictory to what you've been told. My labs are fine, and then I look at them and I show where those imbalances are. Number one, it's very validating, but number two, it can be a little overwhelming for people and somewhat shocking. And so there's a process of grief that has to happen because you knew something was off, or something just didn't feel good. And so now this validates it for you, but now you see it in real time. So now you're responsible for the information, which that is a whole nother can of worms that's opening up. So we work with people step by step. We go over everything. I tell people, okay, we've got a big map of the United States. We're in Virginia. We need to drive to California. What are we going to do? We're going to get on 264. We're going to take the 58. I won't go through all the interstates because I'll get lost without my GPS. And so I am very much that GPS for my patients. And so my job is to guide them step by step and prioritize things in a very efficient process. And so they may not always understand the process, and then they get a little frustrated, especially because my goal is to educate the patient so that the patient integrates this into a lifestyle. So eventually they don't need me anymore. They leave, I release them back out into the wild, and they are able to fully function, and they are able to connect and embody the information that we have provided them. And so it's a really amazing experience as we go through that process, and we see how patients adapt and heal and get well. And it's just such a phenomenal journey that we go through. And I'm very excited to be able to see that, witness that. It literally is incredibly gratifying. And so if you are even in the least bit curious if holistic healthcare or integrative healthcare is right for you, I definitely encourage you. We do offer a complimentary 15-minute consultation, and I will chat with just about anybody about holistic health because that is absolutely my passion in life. And if you've taken nothing from this, just know that integrative healthcare does work if you work it, but it also works if you have the data to be able to prove it. My name is Dr. Erica Steele. Thank you for tuning in. Please share and subscribe this video and comment below if you have any other questions.